have
Started.
everybody here an audience. So we're trying to learn from each other, and so thank you for our guests and our speakers as well. They really nicely volunteer to educate us and teach us from their experience. Should we start with Dr. Messi? Okay.
Yeah.
And then I thought this is a very interesting topic, because
Yeah.
like ozone is my love too, you know. I was ozone and earthing, you know.
I practice ozonotherapy since now 25 years. Okay? I
Okay.
get the first degree, master degree in ozonotherapy that was done from the University of Verona 2 years back. There was a master of 2 years, and I get the degree on February this year. But I'm practicing ozono since 25 years. So I know very well it's not a myth, it's a reality. Many people, they don't know because they don't believe, they don't know. But now we have more than 15,000 papers on the website, on the PubMed, that speak about ozone for many pathologies, not only for orthopedics problems. So I try to develop ozone also I'm doing here in Dubai, and I have very good results. Anyway, so my topics today will be in disc herniation for the cervical and the lumbar spine. So starting to speak about ozono. So the first that invented ozono machine was Tesla. So we speak about many years back. In 2000 in 1866, around this area. So ozono is an unstable allotropic form of the oxygen that imparts an oxidizing activity with various biological components. So when the ozono come inside and enter in contact with the fluid, there are some action, some reaction, okay? Many clinicians utilize ozonotherapy as a topical and systemic agent in treatment of various conditions. Ozono has been subjected to criticism till now, and emphasis in relation to clinical efficacy and toxicity, respectively. But despite to this criticism, many people, they are using ozonotherapy more and more. So, ozono has a great oxidant activity, and when it's in contact with the biological fluids, it forms especially reactive oxygen space, the ROS, and as well lipidic oxidation products. So these two products are the key of the mechanism of ozonotherapy, where the ROS are early, immediate reaction, and the LOP are long term in the time. So when the ozono enters in the system and react with some biomolecule like the polyunsaturated fatty acid antioxidant present in the plasma, we have this hydrogen this is the yields hydrogen peroxide, then lipid oxidation products, early phase, late phase. So the sudden rise in the plasma concentration of hydrogen peroxide generate a gradient which causes its rapid transfer into blood cells, where in a few seconds it activates several biochemical processes and simultaneously undergoes reduction of bath water by efficient intracellular antioxidant system of the body. So the main function of ozonotherapy is that is antioxidant.
So it works on ROS, the immediate one.
Yeah.
And LOPS is the
Late.
and that's by interacting with the plasma.
Yeah.
And that's for IV,
For IV.
for the IV format here. Okay. Nice.
So this critical step corresponds to a controlled acute and transient oxidative stress necessary for biological activation without concomitant toxicity, because we use a very small dose, and provide that the ozono dose is compatible with the blood antioxidant capacity. So while ROS are responsible for immediate biological effect, LOPs are important for later effectors when the blood ozonized ex vivo return in the circulation. This is the autohemotransfusion that we are using now. We have two kinds of autohemotransfusion now. The classic one, we take 200 in closed circuit. We take 200 ml of the blood from the patient, same vial. We inject same saturation of oxygen ozono. And we speak about oxygen ozono because what we use is not ozono. We use a miscela between oxygen and ozono, where per each ml of oxygen we use different kind of concentration of ozono that go from 10 microgram per ml to 50 microgram per ml. It depends which kind of pathology we are treating. For the disc herniation, usually I use, in my experience, is enough 20 to 24 microgram per ml of oxygen. Okay? So, in this picture, we can see exactly that the ozonized blood, when go inside of the pool blood, produce the LOPs. The LOPs can interact with all our organs. This is what's happened, really.
Now I'd like to introduce Mom. She's the
Hi.
ozone specialist.
How are you?
Very
Yeah,
good.
Good
she's the
evening.
one who mixed all the ozone with the blood, and she can fuse this. So I told her to come
Perfect.
speak from the expert.
Thank you.
Yes, please.
So, as I told before, we see that the ROS, they have early action, and the LOPs, they act late. What's happened that the ROS, we have action with erythrocytes, leukocytes, and platelet. The LOPs with the endothelium, bone marrow, and other organs, because work late, and we can have this kind of action.
How late is late?
Allora, the maximum, the EMI life, let's say the EMI life of ozono in our body is 72 hours. After 72 hours, no more ozone is in our body. So that is the EMI life of the ozone. So usually the patient, after, when we do for acute case, and we use it to repeat ozonotherapy, we do 2 times per week, because after 72 hours they need to repeat to refill the body with ozono. So that is the maximum time.
So long acting is 72 hours? That's what you're talking about?
No, that is the maximum. Usually it's 20 minutes, 30 minutes. The early action is very fast, because the ozone is very voluble gas. So the action with the erythrocyte, the platelet is immediately, means few seconds. The other one, maximum 20 minutes. So
20 minutes, what you call it long acting? I mean, I'm trying to differentiate between immediate and
Twe-
long acting.
20 minutes means they produce the LOPs.
Yes, lobes. And then lobes would be working for?
4 is depend what you are doing.
Mm-hmm.
It depends what is your what you are treating.
Mm-hmm.
So it's depend. But anyway, it works for all the part of the body, all the body. If you do, for example, IV, and you are treating the diabetic foot. Okay, I have experience with the diabetic foot. Patient, they come to me with the boot. They cannot work because the foot is completely black. And you do IV with ozono, pushing one section every 2-3 days, I had one patient in Elaine that she complained with the hospital because I left the hospital when I started to treat her, and she came with me to me first time with the wheelchair. After 3-4 sections of ozonotherapy, she came to me walking. Then I left the hospital. She complained, "Why, Dr. Massimo, left the hospital?" So it's working very well.
Nice.
The main application for ozonotherapy we have from topical with the cream ozonized. Also the water, we can use the water ozonized. If you drink the water with ozono, is very good for your gastrointestinal system. This is, for example, if you have Helicobacter pylori. Why? Because ozono has many properties. One of the main property is antibacterial and antivirus. We did the study in Italy when there was COVID-19. We get approval from the Ministry of Health, and I must conduct the study in UAE. But you know, to conduct the study in UAE, you must present to the health authority the project. They must approve. Then you have to pay a fee. The hospital don't want to pay the fee, so I left. But in Italy was involved 11 hospitals, and all the patients that was treated with ozonotherapy, IV, with COVID, before or after they went in ICU, they recover. The patient that was treated with the ozono IV, nobody of them went in ICU. Nobody. The patient that went in ICU treated with ozonotherapy, they come out from the ICU because ozono is antivirus, so kill the virus. Personally, I must tell thank you to ozonotherapy. Otherwise, now maybe I'm not here because I got COVID with bilateral pneumonia, severe. My lungs was completely white. Okay. Before that, I was admitted in the hospital. I did by myself 2 sections ozonotherapy, and then I went in the hospital. Fortunately, I was not intubed. I stayed just in ICU, but in intubed, in observation. They give me all the medicine, and I come out without problem. It was long. The recovery was 3-4 months because with the pneumonia,
Yes.
this was very bad. But I must tell thank you to ozono if I'm alive. So dental now, another is in dental, because anyway we know that the carie is from bacteria. So if you use ozono, you kill all the bacteria. So you can use in dental application.
Only in the bacterial just caries or soft tissue problem?
Soft tissue problem, everything. Yeah.
How do you deliver injection?
There is a
Local?
There is a special gun that can deliver the ozono. It's special for the dentist.
It doesn't interfere the
Yeah.
normal floral of the oral cavity and the GI system?
Yes, could be. For this reason, you must evaluate case by case. But anyway, you can integrate with some integration from the bacterial
Probiotics.
yes. Treatment of cancer. Treatment of cancer like neoadjuvantibus. We speak like neoadjuvantibus, not like I do ozono and I remove the cancer. No.
Adjuvant.
Cancer must be treated by the official therapy, chemo, radio, surgery, but like a neoadjuvantibus, yes. Or like prevention, yes. Why? Because the cancer cell, they develop in anaerobiosis. So if we give ozono with oxygen, we give more oxygen so we can keep them down. Or we can kill them in the early stage. But like neoadjuvantibus, yes, we can use. Because it's an antioxidant, first of all, so regenerate the body. If you do chemotherapy or radiotherapy, you know that the patient go down with immunity. So as immunostimulation that can help you to modulate the immunity. Severe acute respiratory syndrome, neurodegenerative disease, neurological problems. Very important because if we do IV with ozono, we have study for dementia, for neurovascular problem of the, for example, patient that they have some stroke or some problem with what is the neurodegenerative with less blood in the brain. With the oxygen, oxygen is vasogenic, so they develop more vessel, so they get more oxygen in the brain.
How old the patient can you give? I mean, for those, for example, Alzheimer patient, I mean, they're like in 70s and 80s.
There is no problem for the age. There is no problem.
No problem.
Then we speak about also the contraindication, but no problem. Diabetic foot I spoke before, and also COVID-19. So the advantage of ozono that prevents oxidative damage, and we'll die because we have oxidation in our body. The body became old. So with antioxidant stress, if we can block this one, we have different. And acts as a disinfectant. For example, they use for swimming, for the water in the swimming pool, instead to use chloridine, that anyway is a chemical. We can use ozono. Ozono is a there is a pump that pump ozono in the water. The water is ozonized, so you don't have fungi, you don't have bacteria, you don't have virus. It's perfectly sterile.
It's not using the word yet?
Yes.
Ozone used everywhere. Normally using ozone, they are not using the chloride anymore.
Yeah, I don't know.
water.
My
In
pool
the
doesn't
water,
smell
yeah.
chloride anymore. I don't know what they put on it.
Yeah, it's
Anyway,
a common thing that's.
This is
Yeah.
so in this picture we see exactly when ozono go inside of the erythrocytes, increase the glycogenosis, decrease the 2,3-DPG, and release more oxygen to the tissue. Okay. So we speak about the lumbar disc herniation. I don't stay to stay more because everybody of us know exactly the etiology of the lumbar disc herniation. The most part is between the third and fourth decade. There is obesity, diabetes mellitus, smokers, driving, long genetic predisposition, trauma, and mobility. So this is just to have a remember of the anatomy. So this is the disc, the intervertebral disc with the annulus fibrosus, the nucleus. We know that the nucleus pulposus inside there is like a gel, and then is where the ozone react for the disc herniation. Then I will tell exactly what is the reason, because we use ozono in the herniation of the disc. So, according to the sport study, they saw that this parameter was found. We spoke before about this question. I want to go a little bit more fast. So, for the pathophysiology of lumbar disc herniation, is a professor on this, but we can have this kind of developing, aging of the disc, recent trauma, unloading, annulus fibrosus, disruption of tear, disc degeneration, and discogenic pain, back pain. So one thing is very important. So this we can see that in the degeneration of the intervertebral disc, we have a calcification of the endoplate that don't give more the elasticity to the disc. That is the reason for the fissuration of the annulus and then the prolapse of the disc. This is very nice image because I want to put in evidence the difference between a normal MRI and a different 3D MRI. When you do sitting or standing, you can see the difference here. That is normal, this is sitting. So here we can see exactly that the herniation push against the posterolateral ligament. and is exactly inside and touch the root of the nerve and here also the cauda equina. So just I did what is written there. So we see the impingement of the left L3 nerve root that was not seen in a normal MRI. So sometimes the patient come with a normal MRI or little prolapse. You see that they have these little prolapse, but because the MRI was not done in the proper way. So this MRI is very, very useful for the disc herniation.
So excuse me, so you are suggesting that MRIs need to be done in a sitting position and not in
Yeah, because in sitting position you have the load, and then with the load, also, for example, Professor also can agree with me, when we do arthroplastic of the knee, for example, I have one patient now, Italian, she came to me and she did the X-ray of the knee. She has osteoarthritis, but if you see the knee in the X-ray, I can say grade 2, 3, balanced, medial and lateral compartment balanced. So, to understand if I must go for arthroplastic, I can use some other stratagem with stem cell, PRP, hyaluronic acid, physiotherapy, blah, blah, blah. What I do? I do two things that are very important. Standing, but not only standing, but I do also the Rosenberg projection. That is for us is very important because with Rosenberg projection, we can see the impingement of the condyle on the tibia. Because standing, anterior-posterior, yes, we can see the axe of the knee. But when I do posterior-anterior with 30 degrees of flexion, I will see exactly the axe of the knee and the impingement between the condyle and the tibial plate. That case, you cannot do nothing. Osteoarthritis grade 3, patient 65 years old, what you have to do? If she has pain and with physiotherapy or other stratagem, still she cannot go, you have to go for arthroplastic of the knee. So in this case, for the disc herniation, if the patient come and ask and bring an MRI, and you see the MRI, little prolapse maybe cannot give you the clinical symptoms of the patient. Maybe if you do an MRI sitting, you can have a better view, so you can understand better. I don't know if you agree or not.
No, I agree, absolutely.
So this is the treatment. We can go for medicine, we can go for support to physiotherapy or anesthetic and corticosteroid to block the affected root. Then surgery. Surgery, we know exactly that only 5% of the patient with disc herniation, they need surgery. This is international 5% of the patient will need surgery for open surgery or surgery for the back. So there are the absolute indication that is cauda equina syndrome or significant paresis, then you have to go for surgery. Then a relative indication, sciatica that don't respond to conservative treatment at least for 6 weeks, motor deficit greater than grade 3, and sciatica for more than 6 weeks or nerve root pain associated with foraminal bone stenosis. In that case is a relative indication, then you can manage, you can see what's happened, and then you can take your decision. Also, if in my practice sometimes I observe, I start with ozonotherapy and I observe immediately what's happened to the patient the next 2-3 sections, means 7-10 days. I monitorize the patient and I see if he starts to feel better and the neurological problem start to come back, I will not do surgery. I will continue with ozonotherapy. But if in the 1 week, 10 days, still the situation is bad, then you have to do for surgery. Other way it became a problem.
Is spinal stenosis also? For spinal stenosis?
No. For spine stenosis, I can tell you, the stenosis of the spine is due to many component, okay? So if the component means the component is bone, disc, the bats, Venus, with ozonotherapy, you can improve. For example, in the patient that you cannot go for surgery because they have problem with the heart or too much old, with ozonotherapy, at least you can remove little bit, maybe 25% of the pressure, and you can go on with physiotherapy. I speak about
Exactly. You
only.
reduce the hypertrophy of the ligament of the lumbar.
Sorry again?
You can reduce the hypertrophy of the tissue.
No.
How,
So no.
how ozone can
I can
solve
help
the
them.
problem?
I can help them only to reduce the
Inflammation.
inflammation, first of all, because ozone is anti-inflammatory. I can reduce the disc if there is a degeneration of the disc. I can reduce also the edema in the area,
Okay.
but the bone, no. So in this case, as I told you, if the patient is operable, you have to do surgery. But if the patient has a cardiac problem, blah, 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 with ozonotherapy, at least you can little bit manage the pain.
Sorry, so are you making the disc smaller and
Yes.
make it
I
shrink
will-
and decrease pressure?
Bravo. I will explain now. Yes, I will explain now what is the mechanism of action. So the technique microdiscectomy is better than aggressive surgery for the fibrosis and blah blah blah. The incidence of the discomfort is 28% from open to microdiscectomy. Ozonotherapy. The rationale for direct ozonotherapy is that the pain caused by the low back pain with sciatica or cruralgia is due to the nerve root compression with bulging or herniation of the disc. The optimal concentration of ozone per millimeter for intradiscal administration is 27 microgram. For paravertebral, I use 22, 23, less concentration, okay?
Excuse me, so when you say intradiscal, that means into the nucleus pulposus?
Yes, directly, intradiscal.
And how much you inject?
How many
Depends-
cc you inject?
Usually 2-3 cc, but it depends from the disc and it depends how
For
much
one
pressure.
level or for multiple level?
Both of them.
Three totally on these three?
No.
On each one?
Each one.
2, 3,
Each one.
Maximum how much? How many cc? For multiple levels?
For example, we have 3 discs. You inject maximum 9 cc. But there are three techniques for the disc. One is intradiscal, one is intraforaminal, go in the foramen, one is intramuscular, that is the classic. Usually the result is almost the same. The difference is that intradiscal you do 1 time, basta. Intraforaminal maybe you have to do 2-3 times, one every 10-15 days. Intramuscular, you must do 2 sections per 10 sections. So means 5 weeks, because it's more slow. It's different action.
Wait, so when you do intraforaminal, is there any risk for the roots?
But you go with the CT scan.
How much you inject for the interferominal for each level?
Intraforaminal?
Interferominal.
Yeah, same.
2 to 3.
3, yeah.
2 to 3 for each right
Yeah,
side and
yeah,
left
yeah.
side, and
Yeah.
so I can give, for example, 10 if I
Yeah.
have 3 levels.
When I do intramuscular, I give 20 cc. 20.
And
So intramuscular 20 cc.
so
And each level that you do, also intramuscular, you go maximum 5 ml per level. For one reason, because if you give more, the patient feel pain. Feel pain because when you put the needle inside of the muscle stay inside of the fascia. If you put too much ozone,
Close the space, close the space.
push, and there is pain. There is
pressure
pain.
pain.
So,
But also, it is still transforaminal or interdiscal, you have the risk of escape of the gas to the brain.
could be, yes. For this reason, less you use. There is we say less ozone you use, better is for the patient, because the result anyway is the same. don't use too much, because if you use too much, you think that using more, you get more fast result. No, you get more problem with the complications that you can have. So you can have a lipotemic syndrome, so the patient, then you have to reanimate the patient because the pain gives a
What's the
vagal.
essence of gas embolism?
What?
Gas. You have gas embolism. You have embolism.
To inject in the
Air
artery.
embolism.
Air embolism.
Air
Air embolism is, air embolism is very rare. First of all, you must take a vessel. You are not using the technique that you must use. But if you use 2-3 cc of ozono directly IV or in the artery, doesn't happen nothing.
10 cc is a killer amount.
The heart
10
will
cc,
compete in air.
10 cc. But if you use
Killer amount.
2
2 to 3 months.
3 cc for mistake you put in the directly in the vein artery, you are safe. But if you go
To kill somebody.
So this is some points not clear.
yeah.
Facet joint injection with ozone is 2 or 3. How come they can reach the brain? If I'm using the CR, I went to the facet, the triangle.
You speak about transforaminal or interdiscal, it
No,
can reach
no, no,
the
not
brain.
intrathecal.
Or transforaminal, it
I
can reach the
just-
You
brain.
can do also for the faceta because you can inject the ozone also in the eye of the dog. In the Scott dog, you have like the eye of the dog. You put your serum in 20-25 degrees.
Intramuscular at the end.
Eh?
If targeting the Scotch dog eye, it is intramuscular at the end. It is not.
Yeah, this is for the faceta.
Transforaminal.
Transforaminal, you have to go transforaminal.
Okay.
Transforaminal, you have to go transforaminal. It's different.
It's epidural at the end.
For the faceta in the triangle, you say it's different. You go in the triangle, you can do also,
Okay.
but that is different. It's for the faceta.
Transforaminal,
Transforaminal is for the herniation. So
Can
this
you
is
go back
what.
to the previous slide? So what is, yeah, I didn't.
So this is we can see that the ozono make a modulation with the macrophagy for the inflammation and also increase the immune response with the antibody. So we have a action, anti-inflammatory action also that is very important for the mechanism of the ozonotherapy. And here is exactly what I want to say, and I want that ozono react inside of the nucleus. When go inside, the gas react with the proteoglycani of the membrana of the nucleus. So there is a precipitation of the proteins, and then the cell, there is a dehydration of the nucleus. As we do a mechanical dehydration of the nucleus, but we do with ozono, and then there is the result that the matrix is replaced by fibrous tissue and formation of the new blood cell in approximately 5 weeks. For this reason, when we give the ozonotherapy, I tell the patient, sometimes there is a miracle. I don't know what is the patient to patient. Sometimes the patient comes to you with a severe back pain, you give ozono, after 5 minutes that you give ozono, he say, what you give to me? I'm okay.
Decompression.
But sometimes take time. So I tell the patient, don't believe that in one section, okay? Because the disc started to decrease, to become fibrotic after 5 weeks, not before. And when I do the MRI, because I did MRI after the treatment, ozono, to understand, to compare with the previous one, I do after 6 months. Because I will not do after 1 month. I don't see nothing.
No changes, absolutely.
So, so this screen cage, what you told before, can improve local microcirculation and increase the supply. These are other things very important. because we do two things. Oh, qui fa caldo, scusate, non me lo la giacca, sorry, it's hot.
Feel hot.
It's a nice color also.
No, because I'm very
Very Italian.
Excited.
Very
no,
Italian.
means I do my job in the best way. I try to give to everybody
Take your shirt off, it's okay.
the best that I can do. No, so the most important is the microcirculation, because we give miscela that is not only ozono but is oxygen also. So the oxygen there increase the microcirculation, and more blood they go there, more possibility to make a fibrosis, to close make a scar on the disc to contain the nucleus, is also a process that
Annulus.
annulus fibrosus.
Annulus fibrosus. Because the nucleus itself is not.
No.
It's contained in the annulus.
The nucleus is a membrana of the nucleus, a binary membrana with phospholipid membrana that is very, very thin. So we speak about the annulus, yes. So, and analgesic anti-inflammatory effect, this action tied into inhibiting the release the bradykinin or release of allogenic compounds, as well as inhibiting the synthesis of pro-inflammatory prostaglandine and pro-inflammatory cytokines such as interleukina can be neutralized by increasing release of antagonists. So in the slide that I showed before for the immunomodulation, exactly this one. So selection criteria for oxygenotherapy.
Sorry, can I interrupt? I'm
yes.
sorry. So, what you are saying that the herniated part,
Yeah.
you will shrink that part by the injection causing fibrosis, and that herniated part will be pulled back.
Yes.
Not
And the
herniated
effect
part,
on-
bulging part, not herniated.
Yeah, the
part.
one outside
Bulging-
its place.
No, the bulging, we speak about
bulging,
prolapse.
not herniated part.
No, aspetta, we use bulging, and also in
It's called
herniation.
herniated
Also in
disc, that's what
herniation,
we
in
learned.
herniation,
But
we have
whatever name
the
you give
same.
it, yeah.
Means
This is the
that
herniated part.
Anyway, the herniated part also reduce the volume and
That's
come
what
back
I'm saying.
inside.
You are shrinking the disc
Yes,
itself, so the herniated part,
yes,
which causes pressure on the nerve getting
Yes.
smaller,
yes.
and that is a mechanical effect of
A mechanical
the
effect,
ozone,
yes.
as if you are cutting it by a knife.
By knife or by putting inside like papaina or other
Yeah, we got
kind
the
of
message
chemical substance to reduce the disc.
I'm sorry.
It must be contained in
I
this.
would like just to clarify this point. At this point, we have a disc herniation and protrusion and punch.
And sequestration as well.
Okay.
Sequestration.
So now,
Final stage.
could you
Yes.
be more specified? Tell me about this for everyone in part.
Yeah.
What to do? Okay. I'm sorry. I'm just clearing the part.
Yeah, yeah.
Because
what
what
you
we
mentioned is
hear, I
generally-
have a disc prolapse,
Oh.
I have a disc herniation.
Oh,
Is it
was
the
different.
same?
No,
No.
no,
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 no.
The situation
You see,
is
we are not- we are not
we
neurologists.
trade.
No, no, no.
We are learning.
Thank you for clarifying this point,
Yeah.
because I know, but I think he better to tell me which one of these three, because
Disc, the disc could be a prolapse of the disc. The
Prolapse
disc-
means going outside.
Prolapse
its
means
place.
that the anus became malasic, so is more plastic, because the anus fibrosus is rigid, is like a disc, very rigid. Okay, so that inside there is the nucleus, that is like a ball of water that make amortization between the vertebrae. This is a normal annulus. Then we have malasic, so degeneration of the annulus due to the many factors, from the genetic to the lifestyle to something, okay, that became a little bit malasic, and the fibrille of the fibrous cartilage, that is the composition of the annulus, they started to make
Crack.
some small
Crack.
crack inside of the disc. So then we have a prolapse, so a protrusion prolapse of the disc that can be in the foramen, can be on the dura side. When the disc is completely, there is a tear completely of the disc, there is the herniation. The herniation could be contenute herniation, could be expulse herniation, means inside, and then could be a sequestered that the fragment go away, go up or down. Anyway, the mechanism of action of ozono is on the water inside of the nucleus. If the nucleus is a prolapse, so is retained inside, or also there is an herniation, anyway, it work on the water. So this anyway make a fibrosis because the new cell that will generate inside of the disc, they produce fibrosis of the disc. So the disc became smaller anyway. Also in the fragment that is out, the fragment that is out, you know, sometimes it disappears because it's dry alone. But also in that fragment, the ozono has a function. Means that I had patient with a fragment in the canal, and also I treat with ozono, and then they are okay. After 6 months, we did an MRI, and the fragment was not there. Maybe also without ozono disappeared, but anyway, I treat the patient with ozono.
There is some incidence of absorption of the fragment by phagocytosis as a foreign body, as a foreign tissue, whatever. But this is depending on the size of
It's dependent
the fragment
size.
and also the location. But it is very rare to happen.
Yeah, but
because
we cannot generalize everything. You know, it's depend absolutely. It's depend the size, depend the situation. But
When it's
anyway,
sequestered, then really
Sequestered.
the sequester.
It can be absorbed, but
Yes.
it depends on how much the patient is lucky.
Yeah.
If the sequestered part pressing the root, to absorb this amount, you need around 1 year. To phagocytosis this amount of this, you need 1 year. Which patient will come to rating the vein for 1 year?
But for this reason, I told you it's depend also.
But you-
What you told is depend the size of the fragment. It's a big fragment. It's a big fragment. What you do.
So just one question.
Yes.
What's the meaning of to get the nucleus fibrosis? Let's say you get fibrosis. You try to make the nucleus
Smaller.
fibrosis fibrotic.
Yeah.
So that means it loses its capacity to absorb any pressure and everything between the two vertebrae.
Yeah, but this is at the beginning because anyway, you know, our body is completely renewing. Means that the fibrosis there reduce the disc, reduce the nucleus, but it's not forever. Means if I tell the patient that he does ozonotherapy and he never had any more back pain or the disc will be reduce the problem, no. I cannot tell this because the fibrosis that I do then will be reabsorbed with the new cell, create again, maybe this patient has the same problem after maybe 6 months or 1 year. It's not forever. It's for the moment that you are doing this is not permanent. Anything that we are doing on the spine is not permanent. Also if you do surgery, it's not permanent because maybe if you do surgery then there is fibrosis, maybe there is something else. So for the spine I tell my patient nothing is permanent.
Yeah,
Anything you do,
But I think
the
he
aim
was
of-
insinuating that fibrosis, like for us, for the neurodegeneration, when we hear fibrosis, it's a bad thing. So actually,
No, no, no,
you're,
it's-
you're describing a phenomenon, right?
yeah, but this
Yeah,
is small,
phenomenon that might be.
This is small fibrosis. It's a small shrinkage.
Yeah.
Shrinkage means that little bit you reduce.
That's why it's-
Shrinkage as when you do
Shrinkage, yes.
an SCL, for
Yeah,
example,
because
you
when
find
when you
little
use
bit,
fibrosis, I was also like
No, no,
a bit
it's
like
little bit,
confused.
little
How can
bit,
fibrosis be something good?
no,
you
no,
know?
it's little bit.
Shrinkage.
When you put the arthrocare near the ligament and there is little bit laxity and you put the file, you do a shrinkage. Shrinkage means you stretch little bit, but the ligament don't lose.
Okay, its aim actually is to reduce the pressure, interdiscal pressure.
Yeah.
Whatever you will do, either do by heat or by ozone, the aim is to reduce interdiscal pressure. After that, you give a chance for the annulus to heal. If the annulus healed, you solve the problem of the disc. But the first step why is the disc coming out? Because interdiscal pressure increase. That's why the
We,
patient.
we have to reduce the
Yeah.
we have to reduce the water. We have to reduce the pressure inside of the disc. And the screen cage is momentarily, is not forever. Means that you reduce the pressure, but then they start to heal by itself and start to come back. We don't do also if I go inside and I do a radio frequency inside of the disc, because we can do decompression by radio frequency or by the decompressor. I reduce the pressure momentarily, but not forever. So anything that we do on the disc is not forever.
Just in a bracket, because I wanted to catch up with the topic, because I'm not the expert in this area. I was looking to the papers. There is a publication in 2023, just recently, 2 months ago, exactly about it, and they mentioned they don't know why and they don't have any evidence for this, but most of the cases, the number of cases was huge. They come up later, they have regeneration in the nucleus. So the question that you made, that's the fibrosis, it's not a fibrosis. Actually, there is a shrinkage first, and after that we have regeneration there. And this regeneration actually improved the function of the disc on that place.
Because there is the problem of the annulus so the mechanism of action about the disc is reduce the pressure inside. So we can reduce with ozono, we can reduce with many things. The ozono help the disc with the screen cage to make a fibrosis. We call fibrosis like screen cage just to reduce, but then with the antioxidant function and the renew of the cell, because the ozono renew the cell, as I told before, in our body is an anti-aging. I do for anti-aging. Renew the cell inside of the disc, so there is a new cycle of the regeneration of the disc. Plus, the oxygen work on the malasic annulus, try to come back to normal disc with more vessel. What we are doing with PRP or stem cell, almost the same. Anyway, if we speak about ozono, we must speak for maybe 1 week. I try to reduce, but if we speak about the mechanism of the ozono in biochemical way, I must call a biochemical professor to explain all the process, because it's very, very, very complex. But they studied. Professor Ray, that is the president of the World Foundation of Ozonotherapy, is a biochemical, is a pharmaceutical. So he studied exactly the mechanism of action with the molecule that for us could be a little bit more complex, but there is a study, there is evidence.
Yes, it's mostly working in ATP and how ATP is changes and NADP is direct, and the whole this thing is a regeneration and
so they have
antioxidant.
I was one time to a lesson of him, and believe me, at age, because they speak about chemic, so all the process is very, very difficult. Anyway, so the indication for ozono, radiculopathia, pain rather than low back pain. So if there is low back pain, I don't do ozonotherapy. I do only if there is a radiculopathia with the sciatica pain. The patient must have pain in well discriminate and constant cutaneous dermatoma with positive LASEC test, and the score should be 5 or more than the visual VAS. Absolute contraindication is referent allergy. There are some patients that they have also allergy to ozono, and the relative contraindication are bleeding disorders, pregnancy, G6-PDF deficit, hyperthyroidism if is not treated, severe anemia, severe myasthenia, recent myocardial infarction, and the history of mental disease. For the myocardial infarction, because if it's recent, sometimes the ozono can give pain, and the patient can have yes. So
cytokines and this kind of because of the cytokines reaction.
Yes.
Is it painful like PRP?
No.
No.
No, sorry, is for the skin. For the skin,
Very,
allora,
very.
for the skin, usually I use it for acne vulgaris, okay, acne vulgaris. I use it, we have 3 techniques of ozono to give the ozono to the patient. One is topical with syringe in the muscle or in the joint or wherever. The second one is we call small auto hemotransfusion. Means that we take 5 ml of blood, we take 5 ml of ozone together, we mix and we inject in the muscle. This stimulate the immune system and modulate this reaction. And one is local. So for acne vulgaris, I have an example that I did, my nurse, when I meet her 7 years back, completely a monster. The face was completely full of acne, very bad. I did 3 sections of ozono IM and some section under the skin because anyway,
Okay.
now she's a doll.
Really?
After how long?
This is,
After how long?
That's right.
now is 7 years, still like this.
No, I mean.
How fast
when
it
did
works.
When did you see the result? How fast?
Faster, I can tell you in,
7 years.
no, 2-3 months, you can start to see.
Oh, that's
immediately.
good. That's fast.
David, because you know, locally is antibacterial.
Yes.
Usually the
Is infection always is
But
infection?
was it a scar or it was the active acne?
active acne.
Active acne.
Active.
What about the scar?
The scar, I can tell you that are very, very less. Almost normal. Now almost normal.
So upon the application, you need to deliver maybe infiltration of acid.
Yeah, I use the
Topical?
32 G.
30G. This is what we use
Yeah,
the face.
30 Gs. You can put some anesthetic, but also if you don't put anesthetic, I use the insulin. Basta. This because I did also, I have a master in aesthetic medicine. I have a master, 2 years in aesthetic medicine, so I can do filler, I know the
And next
wire,
time you bring-
Botox, medicine.
And next time you bring your instrument and then.
Okay, so for acne vulgaris, another things, rheumatologist, right? Perfect. I tell you a story. You will not believe, but it's a story. It's a story means it's
True
what
story.
True story. Patient with arthritis rheumatoid, with the under medicine from the rheumatologist. She asked me if I can do something. I told her, listen, I don't know, means how you can react, but let's try. So we did IV. I did for her 10 sections of IV 2 times per week. Okay, so in 5 weeks, I told her before that we start, I will see your blood test. The parameter of anti-CCP, reuma test, all the parameters. And we repeat. And I told her, in this period, stop it, your medicine. All the medicine that you are taking, stop it. I won't understand. I can tell you that after the treatment, no more rigidity in the morning. She told me I can go to run. I feel much better. And the parameters, the blood parameters, normal. So I told her you cannot suspend completely the therapy because I did like I want to understand. But what I saw was effectively real. Less pain, less rigidity, and she feel much better, not tired, no all the effect of the arthritis rheumatoid. More motility in the joint. This was very, I was very shocked about this question.
What about your blood tests?
Blood test can make normal.
That means
That's important.
B27 still.
No, that one, no, that one I
It's
didn't
an
notice last time,
arthrodermatoid, it
no.
was not the.
That's not for rheumatoid, that's for ankylosing
Ankylosing.
But
It
anyway,
doesn't go negative at all.
what,
That's your
the parameter was the ESR, the
CRP.
CRP,
RA.
anti-CCP, reuma test, all these tests that they come back normal.
And how long it stays?
Then this patient, I come in UAE and I disappeared the patient because that was 2014 that I come in UAE and I don't know. But anyway, that period that I did this treatment, she was okay. Was the first treatment that I did, like personal experience. Anyway, I will go fast because otherwise I will not finish. So this is a meta-analysis that I did as a part of my thesis that I took in February, and I did the meta-analysis about these authors until 2022. We can see that all findings, the VAS score decrease. And I can tell that the VAS score for my patient, anyway, 87–90% of the patient, they have a very good result. I can tell you, very good result. Then depend also from the osteoarthritis, because that we cannot do too much, and depend the condition of the patient, the age, and something else. But 87–90% the patient, they have a very good result. So the pain decrease, if you can see it before was 7.95, and before the procedure they reduced to 3.9 at 2 months. And the most important that we must understand is this one. Means in the long period, SPRP and stem cell, we will do the same.
Actually, we hit in some point, like effect of pain reduction and regeneration. It's not a matter of ozone or a matter of stem cell or a matter of plasma, whatever it is. The pain reduction playing a very important role in the regeneration.
Yeah, for sure, absolutely.
Yeah, so if you do any method, reduce the pain, you give a very high chance for regeneration because you stop the pain.
Yes.
And you return your normal function, your normal blood supply, your normal activity, increasing the blood supply for the organs. That's why you give a chance for regeneration. That's why sometime now we're working in the stopping of the pain as a target to improve the
With the
function.
interleukin 1, interleukin 2, also in this case. But anyway, my research show me the result. Means it's not a myth, but you know, the FDA still they didn't approve ozonotherapy, but in US, you know, there is a Academy of Ozonotherapy. They are doing for everybody. They want evidence study. Now in Medicare, I want open ozono clinic. I want open ozono. I'm doing ozonotherapy in my clinic in Vogue, here in Dubai. I did also in Abu Dhabi without any problem because DHA don't know, means the ozonotherapy is not official medicine, so there is no regulation about ozonotherapy. Then there is ozono clinic in Rashid Hospital, so it's no problem. There is no
These
problem.
things are not until the private clinic.
That doesn't matter, but there is no regulation. Now what they asking me in Medicare, FDA approved is not approved. There is no evidence study. Until this 25 years that I'm doing ozonotherapy, I did more than 100,000 patients. More evidence than this. This is my evidence. But anyway, still FDA they don't approve. But anyway,
Is it an expensive treatment?
no.
Very economic.
No.
So,
You need an ozone machine.
how much is a session?
One session.
One session, the cost.
Yeah.
The cost of one session here in Dubai, I give to the patient a 10 section for 3,000 dirhams.
So 300 for one. if
300
they want.
for one. And we keep down. We keep down. In Italy, I have out of my clinic 50 patients, every day, because I want to do for everybody. Means, also poor people, old people, not much money, and they pay only 50 euro per section. Usually you can pay up till 200 euro per section. But I do very popular because I want try to give to everybody. And here
I've been using ozone, for every injection. I use ozone with the intramuscular, any injection.
no.
For the joint, for trigger point, for
Yeah.
and really working tremendous. We do it for fibromyalgia.
Yeah.
It's tremendous effect.
Bravo.
Tremendous
Bravo,
effect.
bravo. This is what I want to tell about.
Yeah.
Means today I speak about only the herniation, but if I bring here the protocol that I have, this is the protocol book. For each pathology that you are treating, there is a different concentration and there is a different kind of the administration of ozone. But for fibromyalgia, it's worked very well. Absolutely. Trigger point, because you inject in the trigger point. When I do the cervical spine, for example, I use it to do not only in the muscle, I do 2-3 ml per 4 point or 6 point, and then I go on the trigger point of the nerve here and between the scapular area. Trigger point, the pain disappears, and the patient is happy. It's not a myth, believe me. I'm not selling, I'm a surgeon, I'm a specialist of the knee. My specialty is the knee. So I do knee surgery, this is my specialty, but ozono is part of my life. Right? And I discovered ozonotherapy, you know when? Santo Domingo. I was in honeymoon with my second wife, because
Third wife?
I get 4 years.
Okay. But I know the third. She says 3 or 4 now. Only 4.
Only 4.
Only
Yeah,
four.
Only more, only
That's it.
4.
Yeah.
But I think
Does the
now,
ozone has any relationship with this?
yeah, because I was in honeymoon.
Don't ask.
Every time I get married, get ozone.
And also ozono, in urology, for example, vaginitis. You do ozone insufflation in the vagina, disappeared.
Anti-inflammatory.
It's antibacterial.
Candida.
Candida. A posto. You have, for example, rettocolite ulcerosa or Crohn disease. You do insufflation in the rectus with the patient is better. Because it's
Like
anti-inflammatory.
an ozone enema. What do you inject?
Yes, as I.
There is a special gun.
It will be very. How the volume? If you
What's the difference between hyperbaric and ozone?
Two different.
It's depending the same theory, right?
Are different.
But the same theory is doing
The same theory, but hyperbaric,
increase the oxygen concentration in the
Yes.
body also, the same.
yes, included but there is no zone.
But at the end, the ozone is, you will have a free radical oxygen.
With ozone is antioxidant.
Okay, but what is the component of ozone?
Ozone is O3. It's three molecular of
So you have
oxygen.
one free. It will, the action is coming from the third one, which is a free radical oxygen.
Yeah, but you know how you produce the ozone, no? The ozone we produce, what we do, we produce ozone from the machine. Usually the ozone is produced in the stratosphere, no? With the storm. When there is a storm, then you have the ozone. We produce in the machine in which way? There is the oxygen pass between two electrodes that give high voltage and transform the oxygen in the ozone. Then the ozone go in a filter and pass in a photometer. The photometer make the measuration of the concentration of ozone in milliliter of oxygen, so give you the miscela of ozone.
But the main difference will be the free radical that we have in ozone, but we don't have in oxygen.
Yes,
That's it.
yes, because that is only
The
oxygen.
same thing that's.
That is the only oxygen. Only oxygen and
hyperbaric.
ozone no. So anyway,
Hyperbaric, we don't have any
no,
free radical.
hyperbaric is only oxygen.
High pressure.
Under pressure,
So I don't say it. I just
Yeah,
want.
that's it.
it's only oxygen. There is no,
O3, this is O2 under pressure.
so there is no free radical.
Okay. And then, through this, we use it as a physical oxygen carrying in the blood without RBCs.
No.
Say that again?
This is a study. Oxygen.
Okay.
Normally that everybody studied that RBCs has 4 chairs made of iron, these 4 chairs that carry the oxygen particles to take it to the cell. RBCs, chairs, these chairs are made from iron, where these RBCs the oxygen are connected to these
Yeah.
radicals to these RBCs. Okay. So if in case of anemia or that things,
Yes.
or gangrenous no blood supply or whatever these things, so we use the physical oxygen. Means oxygen under pressure is dissolved in the blood as a free O2 in the blood, not
Blood,
carried by
yeah.
RBCs. This is the secret of this.
And supposed to be going to
I just
the
want to mention
tissue.
that.
Yeah, but
Tissue
this
as
is
well.
what I said before for the neurodegenerative disease, for the brain or for the foot diabetic foot. That is exactly the
The
same.
blood supply is completely closed.
Yes.
And the surgeons say that whatever can't, whatever, so we have to get the cells to stop deterioration, stop necrotic
Yes.
function, stop this. We use the physical oxygen, means oxygen under pressure, that's making the physical state. That means the blood is going on with oxygen in the blood not carried by RBCs.
For the same, for example,
This case,
Yeah.
for example, another
Okay,
thing.
2 minutes left.
Yeah.
I'm sorry, just
So another thing, for example, ozono is lipogenic, lipolytic. We use also in aesthetic medicine for cellulitis. 7 ml per point on the area where is cellulitis, and then manual lymphodrainage to remove the cellulitis. It's worked very well.
It works very well. So that's, yeah.
So I will bypass the cervical spine because the way we don't finish is almost the same. So just I will go to I did also a study here, and also we can see that Japanese Orthopedic Association score 2 and 6 months versus the pre-injection score. So we have a very good result in the complications. Severe age, cardiopulmonary arrest, very rare. Anterospinal cord syndrome that can happen when you do the cervical spine, and if you put too much ozone inside, you can have a compression on the middle cord.
That's
So-
you inject.
Yeah,
Yeah.
so you must be very careful. Means ozonotherapy must be done by a expert doctor. Nurse is not allowed. In Italy, the nurse cannot do ozonotherapy. No nurse, no physiotherapy. If they do abuse of medical profession. The ozono must be done by a doctor for this reason. Okay?
But you have to indicate the route of administration here. For example,
Yes,
Andreas
yeah.
van Kool, you have to be like in the court.
Yeah.
Yeah.
This is the complications, but very rare in the core. Yes,
Yeah.
yes, absolutely. The cardiopulmonary arrest is due to a severe pain with the vagus stress, and then you go in arrest. Can happen, but very rare. Conclusion. La letteratura, the literature confirms that minimal invasive therapy with oxygenozone is safe to use through percutaneous injections for the treatment of lumbar cervical pain, particularly when compared to surgery and drug therapy. Ozonotherapy has become an effective treatment option as it promotes tissue hyperoxygenation as well as treating painful syndromes affecting muscle, tendon, and joint. I use for epicondylitis. I use for periartitis, for the adhesive capsulitis. I use for osteoarthritis of the knee. I use for many things, Achilles tendinitis. In order to prevent the common side effect that ozonotherapy causes, it is essential to continue researching the utility of ozonotherapy in all indications. But this is the state of art now. Thank you very much.
Thank you.
Can I say something funny?
Yes.
In 1990, we was using this oxygen O3 and the OT for some cases. 1990.
90.
Both of us.
I discover ozonotherapy in 1999. That was my, I went for the honeymoon in Santo Domingo. There was orthopedic surgeon near to me, so we spoke about what you do in Italy. He's from Milano. What you do? I'm orthopedic. Ah, me too, eh? What's yours? He told me, no, I don't do any more surgeries. Why? What you do? I do ozonotherapy.
Anche cosa dici?
I do this, I do this, I do this, I do this, I do.
Surgery is a surgery.
And he told me, this is my number. When you come back in Italy, give me a call, come to see, and then you speak. So after 2-3 weeks that I was in Italy, I find this number.
One treatment for
The
everything.
camera, yes, yes.
There is no one treatment for everything. Surgery for surgery. Conservative for conservative.
But I saw, for example, for him,
Okay, you
scar
we move.
on the chest, on the sternum, okay?
كيف حاجة زي كده؟
Treat with ozonotherapy,
خد الكيبورد
normal,
This is
after several treatments.
move your plate.
So I called him and he told me, come in Brescia, come to see what is my practice. So I went in Brescia 3 days. Brescia is nice area, blah, blah, blah. And after that, I saw there is
Call someone to give me
one like in the church, like in miracles. And the patient told me, happy. So I asked the patient, I feel. I told him, listen, how much is the cost of the machine? He told me at that time maybe 6,000 or 7,000 euro. And I say, vieni amore, vieni Vivi, vieni. She's Vivienne. Vieni Vivienne.
Come on.
Was part of the story.
Like father, like daughter, and the colors.
So, and I say, okay, let me buy this machine. That was my lucky star. My lucky star because also if I give for 50 euro, but I do every day 40, 50 patients per 50
The less
euro
calls, the more
without
cases.
invoice, all black in the pocket. So it was amazing for me, yeah. Allora, come ti chiami tu? What's your name?
How are you?
What's your name?
Also.
Eh?
Ozona.
Vivienne.
My name is Vivienne Ozona.
Tabella Bambino.
Amore,
Wife is.
Oh,
she's my wife. Vieni, Cristina.
come join.
The government is here.
Yeah. Allora, she's Sofia.
How are you?
She's my wife. She's a nutritionist. Okay. Now we are waiting the baby boy. Finally. Mashallah. We born 31 of December. Could be the day.
The end
The end of the year. Yeah.
Okay.
So
Any ozone indication for the boy?
pregnancy is a contraindication.
To
So,
bring a boy, maybe you need ozone.
All right, now thank you very much again. It was really such a beautiful discussion, and I'm passionate about ozone like you because I use ozone quite often with my treatment. So now we have another challenging case really, and now something about using stem cell in Bell's palsy or facial abnormality. So we're gonna have
Yes.
your so
We need someone,
somebody,
yes,
I think,
yes,
to
before
Moses.
presentation.
Yeah, to help us.
I think this is mine. Yes.
è stata lunga, Cristina. Ozono è
I just noticed
sbattimento,
from your, from your
Can you?
pretty much accent that
Yeah.
you're something has to do with French or
I'm
maybe
French.
you're French or North African French?
Actually, my father is from the.
Algeria.
No.
Yeah.
For the Caribbean islands, close to Cuba.
nice.
Cuba?
Yeah,
San Martin.
not San Martin, but the French islands, which is Guadeloupe and Martinique.
Martinique. I was in Martinique, I was in Guadeloupe, I was in San Martin, I was in Santo Domingo. I like Caribbean, Jamaica,
All these islands.
Santo Andres, the Columbia Caribbean. It's very nice also.
Yeah, I'm from French Caribbean. Yeah.
The Swiss. You are a Swiss.
So the meaning is you said that my accent is so bad, huh?
No. Doesn't fit with us.
Accent can be bad, can be different, but it's not bad. There is no good or bad. Obvious or not.
You know, when you're in a city where there are 220 different nationalities, don't ask about accents.
No, but it's interesting. Why not? And the Ira surgeon?
It's not the leading edge. This is part of your presentation, but it's not
Manual
showing.
therapy.
Yeah, this one also.
Which kind of therapy?
Manual therapy.
Manual.
Yes.
Like physio.
Physio, osteopath.
You just get
Only in America. Only in America.
It's not select. Yeah, I did it.
Can you?
No, it's not.
Okay, let.
Yeah, just a scale.
I do mechanics. I do mechanics.
Mechanics of the
I
body.
feel right.
That means, yeah, I'm more based on
Moses.
anatomy and
Moses.
physiology
Yes.
for
Video
back pain
pictures.
or if we
From
we
that-
connected with the musculoskeletal system, but
From
not
that-
only.
That's nice. And where is it?
People cheat and cut.
Where are you?
I'm nearby.
Ah, amazing. Great meeting you.
Thank you.
Okay.
Ah, osteopathy.
I know Brescia because I want to be
Okay.
in Brescia.
Now Dr. Dalia is going to give us her secret as well, you know? Now, today it's really very dynamic, new treatment, you know?
Okay,
So-
please. Good evening. First of all, you can enjoy your meal while I'm speaking. I'm Dalia Sadiq Hassan. I'm an oral maxillofacial pathologist. Then I turned to the area of stem cell by my new project in PhD. I specialize or tend to specialize in cancer stem cell. Then I just get expert maybe as a junior scientist in or therapist in stem cell. So today my topic will be in management of cellular management of facial palsy. So what is facial palsy? The facial nerve is the seventh cranial nerve. It has complex nerve that provide innervation to many areas of the head and neck region. It contains motor, sensory, and parasympathetic called secretomotor nerve fiber. That is to say, nerve to the gland, whether the salivary or racemar. The facial nerve disorder can be either central in the level of upper motor neuron paralysis or peripheral after the nucleus or post-synaptic. So what is the etiology of facial palsy? The most common causes of facial paralysis may be viral infection to the facial nerve, may be due to head trauma, like car accident or so. Neoplastic causes may be parotid gland is the closest structure to the facial nerve. So parotid tumor and head and neck cancer may be an etiological factor for facial palsy. Stroke will act as central cause of facial palsy. Maybe facial palsy produced by doctor problem, doctor failure to treat accident trauma by doctor called iatrogenic. And last but not least, the idiopathic cause of facial palsy called Bell's palsy.
And COVID vaccine.
Excuse me?
COVID vaccine.
Yes, I read this in
How many?
literature. Yes.
The daughter of my
Yes,
brother,
it happens.
23 years,
Yes.
she get the COVID vaccine.
Vaccine then.
She get a bad paralysis.
After
Yes.
how long?
After 2-3 days that she get
Yes,
the
Yeah, you
yes,
saw
it's
that?
present in the
We
literature.
see a lot of shingles.
Maybe
We did see shingles after vaccine or mostly vaccine or after even.
maybe
COVID.
due to the
the fact that the virus, a certain virus of shingle and COVID go and be latent in certain ganglia and then be reactivated by various causes, maybe heat stroke or even the vaccine.
The case that I said to you,
Yes.
you remember?
Of course.
15 years old girl, she get the vaccine, she get completely middle cord, cervical middle cord, mielite, transverse myelitis, basta, finito. She's like a vegetal now. We'll try to do stem cell and we'll see what's happening.
Then she recovered?
No, here you go. So 8 months now she's on the, and she was with the stonia for intubation for 4 or 5 months. Then now the diaphragm started to work, but she's completely paralyzed.
That is very
Post-COVID
Yes,
vaccine,
yes.
14
Yes. Not in
years
the
old.
literature.
Did you try with her stem cells?
What we are doing now.
We're trying to do this. Not yet.
You take it from the bone or from the fat?
It's still not.
Plant, just plant.
It's better to take it better to use both. I'm sorry, just
Yeah, tell me.
it's so miserable case.
Yes.
Make it both from the blood and from the fat. From the blood, BRP, and from the fat, take it the same day, as well as the stem cells. Okay?
Yes.
And then give both.
Okay.
And in this case, try to get anesthetist and put it in the
Yeah,
CSF.
Yeah.
With a mechanism, of course it's lumbar, don't go up, okay? But you have to put him in this position after the injection, so the gravity makes its way for that. And trust me, both, because PRP have more these cross factors, while the stem cells.
Is it like a booster?
Yes.
The PRP work
Put
like
in this
a booster.
position, get injection, inshallah within 4 to 6 weeks.
I know this, but now the problem is, believe me, sometimes I did for charity, because one of my patients sent me the photo. He told me try to help this woman. So I speak with our friend, Professor Mike. There is a cost. Now the parents, they start to say, no, because we read that she can also die with the stem cell. I told, listen, your daughter, if she will not do, and now it's 8 months, as soon as possible, nothing happened.
Too late.
I prefer that she die, that I keep her for the life like this. I told them like this, so they stopped it.
Okay.
Let's keep going.
Carry on, please.
So this is the photo or picture, or maybe illustrated, to just notice the difference between the affected side and the normal side. Of course, yes, there is a dropping in the smile line of the patient, and the eye couldn't be closed normally, and the patient couldn't wrinkle his forehead. Maybe what is the signs and symptoms of facial paralysis? Here the patient, you notice her eye is going red due to the cornea, maybe reach until ulceration of the cornea and dropping and the loss of facial expression and inability to wrinkle or brow, the dropping of the eyelid, inability to close the eye will be constantly just open.
Also the night means
Yes, the patient cannot close the eye all the time. So the light,
Dryness.
yes, dryness occur, and the eye start to be infected and irritated, inability to buff the cheek. So patient will start to feel insecure about their appearance and aesthetic appearance, and that's why. So what are the prognosis and treatment options? Severity of facial palsy can vary depending on the underlying cause and the extent of muscle damage. Mild cases may only cause minor facial weakness, while severe cases can lead to complete paralysis of the face and loss of the facial expression totally. And as I said, patients start to feel shamed or insecure about their appearance. There are several treatment options available for the facial palsy, including traditional treatment, which are physical therapy, medication, especially in the onset of the facial palsy, and then maybe surgery option also included to just decompress the nerve, or maybe to do a graft in some instances. However, the effectiveness of these treatments can vary depending on the cause and severity of the lesion. because some patient may experience long-standing and persistent symptoms. That's why we just thought about cellular treatment and cellular treatment option of facial palsy. Maybe a bone marrow derived stem cell, you can use it. A study in Brazil in 2015 investigated the role of mesenchymal stem cell potentiality in nerve regeneration among rats with unilateral facial nerve injury, and the results showed significant increase in nerve diameter explained by ability of the mesenchymal stem cell to assist in nerve degeneration. The literature said that there is a very regenerative role of the mesenchymal stem cell in nerve degeneration because they acting in the nerve diameter increasing.
Sorry, which route?
In the rat, they inject it in the trunk of the nerve.
Direct.
Yes, direct. Yes. Okay. Another studies also use the platelet-rich plasma, which are PRP, in case report study held in Hungary, 2017, using PRP. The peripheral blood mesenchymal stem cells they found it multipotent, and plasma contain, of course, growth factor involving in tissue regeneration. The transplantation of the peripheral blood mesenchymal stem cell plasma promote the recovery of the paralyzed facial muscle in Bell's palsy. The treatment resulted in both morphological and functional recovery, including voluntary facial movement. The findings suggest that the peripheral blood bone marrow plasma has the capacity of facial muscle regeneration. Here are the steps to get the PRP. You take the whole blood and then you do separation of the platelets by centrifuge. Then you do second spin and then you get your product is PRP. In Poland, they use adipose-derived stem cells, which gained by the adipose tissue. You do liposuction, and then they found it an attractive cell source for tissue regeneration. Why? Because they have self-renewal capacity, they have capability of high growth rate, and they have multipotent differentiation property. That's to say, it has the capability to transfer in any cell type. They can be easily also isolated, as I said, by subcutaneous adipose tissue, by safe and conventional liposuction procedure. They also easily being purified and propagated in a culture. The adipocyte stem cell can influence accelerated nerve regeneration, and they also can promote angiogenesis. They secrete number also of growth factors and cytokines, making them a very attractive, cell source for the treatment. So a new cellular therapy is the stem cell derived from human exfoliated deciduous teeth. It's a mesenchymal derived stem cell. We obtained it from the pulpal part tissue of the teeth, of the deciduous teeth. Then across many laboratory sophisticated maybe steps, we can gain stem cells.
That's from the tooth?
Yes.
That's special.
Where is the rest of the? Okay. So also there is extracellular vesicles, the favorite of Fatma. It's a product also gained by several laboratory steps. They use it also in the. I'm afraid some of the just appear. Can you?
You good with it? Can you see the problem with her or call Moses?
Uncle Musa.
لا ما عارفة ما باينة معي.
You went ahead of yourself?
لا في ما doesn't appear. Why? I don't know why.
Then maybe not downloaded yet?
No.
So,
they cannot open it.
Sorry? Can you call him?
you go back. Calling the person.
If you go back to slideshow and then you
Yes, maybe.
Then start from the one you want to show to the screen.
Why?
The second to the left.
Here?
No, no.
No.
Left, 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 left.
From current slide.
Again. That one.
Oh.
Why it doesn't appear? No. Here is used to be some. There is
It's
valid,
coming
coming
up.
up. Valid information are there. But
Do
do you have the flash?
Your slide.
Yes. I have the receipt.
Very good. Have full of stem cell. And loaded with ozone.
We're going to the cream.
The cream is ozone. This is we called actually
Halef?
Why? There is
Surah.
something written here. Why?
Uzi, yeah, but and very
There's
popular
two
in
positions.
Syria.
Can you
It's kind of like mixture of meat on it. And
You're vegetarian?
You're vegetarian. You can
the
take it
flash,
out.
can you-
This one.
Thank you.
Sorry, we need to make sure.
Can you please
You know.
just make sure? Mm-hmm.
Where you know?
Yes.
15, I
This is my
think.
presentation.
Yeah, what page you are now?
Can you?
I think
On
15 was missing,
15?
yeah, no. Yeah, 13.
No, I think from the after the
12.
adipose. Yes,
12,
from here.
yes.
From here.
Oh,
Yes. Thank
okay,
you.
perfect.
So you got that.
Yes.
Stay around here to see, make sure it's good.
So the oral mucosa, gingival lamina propria, contain a small population of neural crest origin stem cells, including mesenchymal stem cell. After isolation and in vitro culture, this neural crest derived stem cell can differentiate. Please just focus into classical neural crest lineage, such as neuron and Schwann cell, as well as various non-neural cells such as melanocyte, endoneurial fibroblast, and subpopulation of bone marrow and dental mesenchymal stem cell. A number of studies have investigated the stem cell transplantation, both in combination with the nerve conduits and alone, demonstrating significant beneficial effects on rat facial nerve regeneration. The total word need to be said here that stem cell obtained from deciduous teeth can be acting as cell source for treating nerve or facial nerve, causing nerve regeneration.
That's great. Yeah,
Yes.
that's
A study held in Brazil in 2018, they utilized experimental rats with crushed, they did crushed facial nerve culture, and they have used SHED, which is abbreviation of the stem cell derived from human exfoliated deciduous teeth, have been observed produce neurotrophic factors. And that is the interesting thing of SHED, because they have neurocrest sharing origin. So they act as neural growth factor and brain neurotrophic factor and glial cell derived neurotrophic factors. This production of neurotrophic factor has shown therapeutic benefit in various diseases. Of special interest of this study, SHED have been demonstrated to differentiate to in vitro Schwann-like cells. That's why they may have great attention and may be used further in upcoming researches. And this is me working in the MBRU laboratory producing and growing stem cells.
How, you know, that's each pulp, how many cells can you extract, and after that, once how long it's taken, in which cycle you are using it?
So which passage you grow them until maybe 3 and 4, 5, 7 passage, and then you administer them.
And then they extract
Extract
how
them and
many
grow
how
them.
many cells? For example, from one pulp, how many cell you can come?
Maybe they wrote in their paper that 2 to 4 million.
2 to 4
Yes.
million. So to do a treatment, for example, once we are doing the cell therapy, we need 100 million.
Yes.
You need to
That's why
multiple-
they just acting on rats. Maybe this is
Yeah, because
enough.
once we are doing in human,
Yes,
the
you need
number
multi,
is
yes.
it's
need to
so-
be more. That's why.
Okay.
So moving on, SHED are they the best source of mesenchymal stem cell? Bone marrow mesenchymal stem cell have already been shown to potentiate neural regeneration. However, shed are shown to have higher potential for being simpler with higher rates of cell proliferation in vitro and with a better potential for neural regeneration, possibly because they are directly, as I said, derived from the neural crest. In this study, they showed potential role of shed for in vivo differentiation, more appropriately attending the demands of the microenvironment. Another study held in Korea recently in 2021, treatment of idiopathic facial paralysis, that is to say Bell's palsy, secondary paralysis. They used extracellular vesicle, the exosomes. They recruited 7 patients, real patients, not rats, in safety pilot study that utilized innovative treatment approaches with beneficial safe method to enhance the nerve regeneration, especially in cases with persistent symptoms. Their design of study, the exosomes or extracellular vesicle was injected into the area of the facial nerve main trunk, which is in the area of the parotid, yes. On the affected side, they accompanied it by drip on a visit during
Drip?
Yes, they give the patient drip, accompanied by drip on the visit during 1 to 2nd and 4th week. All the 7 patients showed obvious improvement with the use.
You mean IV drip?
Yes, IV.
That's what I'm asking.
Yeah, yeah.
Drip,
Yes,
I
IV.
That's right.
IV.
So they did the trunk and IV.
Yes,
Okay.
both.
Local and
So,
intravenous.
yes.
Yeah.
All right.
So their findings are supported by very recent study, the former study in July in 2023 in China. They proved that mesenchymal stem cell derived exosome promote recovery of facial nerve injury by their healing properties based on their promotion of axonal regeneration and myelination, both mechanism. Ability to decrease localized and systemic inflammatory response as well. All this is supported by research that resulted in mesenchymal stem cell exosome can in control by new modality, which is macrophage plasticity, to help them polarize into anti-inflammatory phenotype, which inhibit the production of pro-inflammatory cytokines. So the exosome will work in the macrophage plasticity to polarize them, to enhance them in the role of the anti-inflammatory phenotype and production of pro-inflammatory.
Which type of MSCs were they?
Bone marrow. They are bone marrow.
Bone marrow mesenchymal
Yes.
stem cell. But is there any control group? Because majority of Bell's palsy, they recover spontaneously without treatment as well. So if you don't have any control group,
Yes.
there is no reason
Yes.
that's
They are recruited the 7 patients who were have persistent symptoms.
so it
So
was
not-
a cycle of the
Yes, yeah,
it
not-
was not a new
Yes, not new onset. So this is laboratory maybe steps to obtain your exosomes. Very a little bit complicated. So I reached the umbilical cord mesenchymal stem cells. A study recently executed in Korea, published very recently in 2023. The patient recovery from Bell's palsy after treatment using uncultured umbilical cord derived mesenchymal stem cell, which is a case report study. They treated a patient who suffered for 7 years from facial palsy by uncultured umbilical cord derived mesenchymal stem cell transplantation. Why they use uncultured one? Because previous studies stated that culturing of the mesenchymal stem cell undergoing changes in their properties, cytokines and protein secretion due to cell aging by the culturing. That's why they use uncultured umbilical cord. This is the step, yes. This is a step to gain umbilical cord, either by tissue or
Do you know that as well as the, not only the umbilical, the fat cells, liver age?
Sorry?
What do you mean by that?
Fat cells,
Uh-huh.
you know, when you take the stem cells or what therapy, when you take, you say from the bone marrow
Uh-huh.
or from the fat. Bone marrow is an aging cell.
Yes.
So anyone
Adult.
more than 30, the line going down.
Yes.
30, not 40.
Yes.
So
Ah,
until
yes,
30,
that's
take from bone marrow. You are dealing with 50,
Yes. Yes.
go to the fat, because fat never age.
Yes.
I'm sorry, it's just a.
This is a very
You can pay me for
important
this.
and crucial.
You can pay me for that. no problem.
I think it's debatable. Yeah, but also, I mean, this is a very, very interesting study
Yes,
because
that's fine.
if you can take from fat, then it's fine. You can just by, enzymatically extract them. But I don't know how they did.
Uncultured.
How, yeah, because you are removing from the cord itself. So you need to do some kind of
Yes, yes,
manipulation
yes.
to get the cells. So how did
Yes.
they get these cells?
I can share the paper.
Yeah, I mean,
Yes.
it's
So how
really
did
a
they
very
do it?
Interesting, very interesting. So
Is it
they
uncultured or they didn't induce anything? You know that sometimes we give we do the induction or it's a culture because anyway
Is this
once
the image from the paper themselves?
No,
this is
to
your-
illustrate.
okay.
This is to illustrate just.
Okay.
Then
Because
there
this
is
is culture.
yes,
You
yes,
put
yes.
it on the plate.
So the study design of their
Nice,
study,
yeah.
they prepared a stock of 4 ml injection solution consisting of uncultured umbilical cord derived mesenchymal cell before injection. The prepared 4 ml injection solution was divided into 4 1 ml ultrafine insulin syringe containing 1 ml each. They inject the injection solution evenly over the affected side of the patient face. Each side was injected with
On the face? Not-
yes, and of the affected area of
Yeah,
the
yeah.
yes.
So not the.
They make a marks. They made a mark and then injected all
Mhm.
at the depth of 0.4 to 6 centimeter. A total of 16 injections were performed in an interval of 2 months. The outcome: the patient received total of 8 treatment at 2-month interval for 14 months and was followed up 18 months after the end of the treatment. The Bell's palsy did not recur during this period. After the treatment and transplantation of the cell, the patient experienced rapid improvement.
Do they have before
And
and
this
after
is
picture?
for one. Yes, I have the picture. I don't know
How many cells? Because they only mention how many ml and how many cells do they have
They-
and how they
Maybe I
Come up with
I
that.
prepared the all the studies, so I will share it with you. But I don't
Excuse
know.
me, I can just tell you from other studies, okay, 10 million cells.
no. I mean, in this study because they mentioned
Ah.
uncultured
Uncultured.
1 cm. It looks like that they
Very little
only
amount.
injected
Small.
blood or something else. It's not
Morphine jelly.
the Morphine jelly or
Maybe-
something.
maybe.
It's not
They
the
didn't even mention
mesenchymal
Morphine jelly.
stem cell.
Because
Because if we go for mesenchymal stem cell, we need to come up with how many cells and all these
Count.
the things that they mention uncultured and based to ml. It looks like that they only straightforward inject something from Morphine jelly or the blood. Not
They didn't mention.
you know, I was just wondering, like you did before, when somebody talked to him and they tell me that I inject here 2 ml. So I tell him, okay. Then I ask him the same question: how many millions just in this 2 ml? So I discovered that most of their work is on spot, as I told you. They go to the patient, get the fat from him,
Directly.
take the
It's the
fat
medical
directly,
Directly.
get to the lab or to the bank, and they separate
Mm.
the
True. And they have no idea of
the
the
cells,
number.
separate it, bring it to you.
Yes.
You understand?
And
They
they have
don't
really
mutate,
no
no
idea.
mutation.
Yes, yes.
When they mutate, it takes
Mutate.
1 month to take the million.
Expand, yeah.
3 weeks minimum. 3 weeks.
That's called
I mean,
SBF.
whatever, accordingly,
Expand.
because it's
So
a.
just they take the cell, give
Yes,
to you,
they
basta.
I give it to the bank, this fat, just a couple of hours.
Yeah.
They bring you 2 ml, 4 ml.
Yeah.
Okay, then I injected that once. So that's why we normally now act as 4 ml, because I work with this rapidly than the bank and the mutation and thousands, millions, because this is rapid and gives very good actions,
Yes.
and money is less because the bank takes
Because-
half of my money.
Divided. So
But this is a
actually,
mixture, not a pure stem cell. This is like a mixture of all cells, including stem cells.
Including some cells, yes.
It has a stem cell
It
in,
has-
but
Yeah.
it is not a stem cell. That's
Yes,
the reason.
some
It's not
No, no, no. They
exactly a
separate the
stem
stem
cell.
cells, and according to what type, because you have several types of stem
Actually,
cells, but you need more. It's a fibers of,
Can I interrupt?
Please.
I have a full lecture about different type of mechanical separation of stem cell, enzymatic separation of stem cell, the difference between the SVF of each, and the difference between the SVF itself and expanded culture cell. There is a full lecture on the 18th of this month, so
But
I
this
don't
is-
want to
but
disclose it
this is-
now.
No, this you have to pay for that one.
Everything
This is
you
mainly
That's
for the
paid
lab doctor, not for
Valuable
us. I
information.
need this, please, I need
No.
stem cells from this fat.
It is
So
for
intake
the
me
doctor.
for what? I tell you for CSF or for whatever. You know what I mean? At this point we are team. You know what I mean? So what is meant is a huge things, but it's not my part.
Yeah, but when
It
you
is,
make
it is
this
for
effort,
everybody.
yeah, but when you make this effort, you can understand what the lab is giving you,
Yes.
under which criteria.
Yes, sure.
And
I don't
you
understand
can,
this. I mean,
No, no, and you
uh,
can as a clinician then assess which one is better in terms of outcome. Because if the other guy is just working on himself, depending on what he has, and not communicating the number or the method or what it's supposed to be, or you don't even know what the mixture is, then how are you going to assess? How are we going to help
Measure
the
outcome.
community to help and give something back to the West that is doing everything and assessing and doing these clinical trials and everything, and you don't even know what is there. And I've seen work that is being done here and products that should not be. This is a failure. It should not be introduced into patient and it's given to patients.
And it's very dangerous.
So it's really, I mean, yeah, according to what we know, maybe we're inventing something new. Maybe these mixtures that are better, but we need to document. You need to know what he's doing. You need to take the time to understand what is there inside.
so you have a lab for
And-
this?
No,
there
he's,
is-
No,
he's,
but-
he's done a huge effort to understand what stem cells are and everything, So
We will show you.
he's really an expert,
We have
theoretically.
day 3.
He has
day
never
3.
worked in the lab, but
have
I
not
really
worked in
like
the lab,
the effort he
but we
made.
have the practical part. Sorry for
Yeah,
that,
okay.
but I have to clear.
No,
it.
no, yes.
You know,
Back in
I
what
can
you
tell
provided.
you,
This point, very
Yeah,
nice.
it's very important.
I spent 5 years on liposuction. I didn't do any single liposuction, but I have seen, I have attempted. I know the 5 or 6 techniques of separating the stem cell from the fat. 5 are mechanical, one or 2 enzymatic
Okay,
digestion.
Professor, can I ask you one point about this before you go? What do you prefer, negative pressure or just a syringe?
I don't know the technique, that's what
What
I
do you
said.
prefer? Oh, you don't, no,
I am-
theoretically.
No, what I'm saying, I said, I will review the current 5 or 6 techniques of liposuction. And in each one, we will show you the amount and the number and the type of cells at the end of the day separated from the liposuction, and what is its clinical application, and what is the content of this stromal vascular fraction, and which one is superior to the other, and which one you can give intravenous and the other one is not allowed. So that's we will show the technique. My co-worker will come with me and he will show the technique. For me, I will present the science itself and how we doctor should know before getting this material from the technician and he give it to us. We should know what is inside that, because all are different, and what is the clinical application of each of it, and what is the value and the number of cells, and what are the combination of types of cells in each stromal vascular fraction. For me, I am a clinician and I need to know that, and I don't want to use it blindly. If anybody, in the market, sorry again, I talk too much, in the market there are 6 machines and 6 medical reps come to you. I have a liposuction, this is $300, this is from Korea. The other one comes, no, I can give you 200. This is from China, I can give you 150. The other one said, no, mine is 1,300 because I use collagenase. I separate the cells. I can give you 7 types of cells in the stromal vascular fraction, and you can give it
I
intravenous.
ask for a type of cell,
I can't
but
tell
of
you.
course I don't know
in
how
the
to do it.
lecture
I
it
don't
is
know.
there.
Yeah.
This is the point.
It's okay.
But
In
I
laboratory.
ask, I need
But in
this.
laboratory.
Can I add something for what you mentioned? Okay.
If the chairman allows.
Of course, I want. When we use the negative machine,
Let me make that announcement before you leave.
Yeah.
so it's better to use the syringe.
Yeah.
It is syringe. Yeah.
Don't
It
use
is,
the others. None, but they allowed to use this, and I look at them and I don't talk.
Let me talk about the, we have a course, by the way,
Did you
that's what
finish?
the,
Can you clap for
let me
that?
comment on since we started.
So
this is
How about this?
Where am I? Where am I?
You
This is a
started
good
to come.
picture.
You started to come this journey.
Okay.
And the other
Okay,
is
so,
this
so, you know, we have a course, gonna be
We should
started,
announce the course.
yeah, on the 16th, 17th, 18th. And, you know, Dr. Kwan, the director of the course, and we have 17 speakers. Gonna be cover all aspect of stem cell application and, you know, also technique. And, you know, that will make you prepared to be American Regenerative Medicine Board. And this will like more like preparation for that. And this will be more like followed by 2 months of discussion online, plus maybe online lectures and group. And then we're gonna have also preparation for the board examination. When you are taking all this, you can take the board exam here, the written one, and then you can get the oral as well. After you pass this, you'll become, you know, American Board of Medicine certified. And naturally, diplomat, sorry, diplomat.
So I just today I received the certificate of the membership.
Yes.
In the
Society.
newly, yes,
Congratulations.
society membership, yes, and the newly prepared board, which is the dental regenerative medicine.
Yes, nice.
Yes, I'm
Very good.
preparing. Yes, I'm preparing for the exam, so the
Yeah.
course will be very valuable for me. I was
So that will be really something we are, again, something like that, but much more an academic, you know, level.
background.
You know, and you know, Dr. You know,
I'm giving the first lecture.
she gave the first lecture, the most difficult
Of
one.
course.
And you know, many lecture for Dr. Kiwan. So we have really many speakers who can speak about this, and I encourage everybody to really join, because again, this is a new field, and as you see, really like East and West, they do this way and this the way, and I feel like
Controversial.
not very standardized it, and that's why like FDA coming across like, you know, we need this
Stabilized.
study, and so I believe, you know, it's very good to get ourselves and have a lot of application in us, like rheumatology was talking about case, you know, I mean, he trained himself and like, wow, you know.
Yeah.
So again, you know, I recommend and to attend this course. We can send you invitation if you are interested to register. We have only a few days left to start actually next week.
On 16, we have also a lecture I just prepared today on the DHA regulations. Because DHA regulations like 72 pages and it's very vague, really very vague. And I was involved in version 2 in writing the, so I present the lecture. And it is very important that before we know we are allowed or not, what is the FDA, what is the DHA, what is the European, and so on. It will be interesting, I think.
Yeah, it is a beautiful kind of preparation for somebody who is interested to enrich, and could be just by his lucky accident, like ozone, he did it, and just we do just like that, you know. And we are as a group here, we're really passionate about stem cell, you know, and really, unfortunately, we use it clinically, and we have a lot of good results. So keep using it, but you know, again, we're building our own experience, you know, and with our patient.
Now, the last question to you, all these studies are Bell's palsy.
Yes.
What about central?
No, it's
No-
not
no study.
published in
That's a
the-
study.
Yes, because
Yeah, we can take pictures,
Okay.
tradition outside, we take pictures, you know, outside. Okay. Now you'll be in the picture.
Okay, that's cool. Okay. Thank you.
Welcome.